Welcome back to Catalyst University. My name is Kevin Tokoff. Please make sure to like this video and subscribe to my channel for future videos and notifications. And a big thank you to my patrons on Patreon for your contributions to my channel. In this video, we're going to be discussing the major muscles involved with deglutition, which is a fancy term for swallowing. But before we get into the individual muscles, let's first consider this bolus of food right here that's in the mouth, and it's been mechanically chewed up by the teeth with some contributions from the tongue. So when we initiate swallowing, we of course have to move this bolus of food from the mouth, essentially the oral cavity, right down here in the picture, ultimately into the oropharynx. So the oropharynx is this region of the pharynx there, right where my mouse is, that's posterior to the oral cavity. And so that bolus of food crosses the oropharyngeal isthmus into the oropharynx. Now once that bolus of food is in the oropharynx, we don't want the food to go back into the oral cavity. We want it to be unidirectional from the oral cavity into the oropharynx, but not the reverse. And so one of the things that has to happen during swallowing is narrowing, essentially closure of that oropharyngeal isthmus. And this is facilitated in part by a muscle called the palatoglossus, which is associated with the palate. We're going to be covering that in the next video. Now remember, there's three components of the pharynx. The part directly posterior to the oral cavity is the oropharynx, but above that is the nasopharynx, and below that is the laryngopharynx. Which direction do we want the bolus of food to move? Well, we only want it to move into the laryngopharynx, which basically carries it down towards the esophagus. And we of course don't want the bolus of food moving up from the oropharynx into the nasopharynx. So the way that we prevent that is by essentially closing off this passageway through the nasopharynx by elevation of the soft palate. We'll go over this in more detail in the next video, but if we take a look down here, we actually see in blue this bolus of food that's right now in the oral cavity in picture A. We haven't yet initiated swallowing. Up here is the nasal cavity. Back here is the nasopharynx, and then right here would be the oropharynx. And then separating the nasal cavity and the oral cavity is the palate. So right here we have the anterior bony hard palate, and then over here posteriorly is the soft palate. But if you look here at the nasopharynx, notice that it hasn't been closed off. So technically the nasal cavity and the oral cavity, things like air or liquid or even a small bolus of food or a piece of that can travel between the nasal cavity and the oropharynx. So what has to happen? Well, the soft palate has to elevate. A couple of muscles that are involved with this would be the levator veli palatini muscle and also some contributions from the tensor veli palatini, although the levator muscle is more important for elevation of the soft palate. And by elevating the soft palate, we essentially block the flow of the bolus of food from the oropharynx through the nasopharynx and ultimately into the nasal cavity. Now, when there's failure of these muscles for whatever reason, you essentially can get the bolus of food or liquid, whatever it happens to be, from the oropharynx through the nasopharynx into the nasal cavity and potentially out of the nostril like you see here in the picture. And I'm certain that this has probably happened to all of us at some point or another. And by closing off the oropharyngeal isthmus and the passageway between the oropharynx and the nasopharynx, we're essentially allowing unidirectional flow of the bolus of food from the oropharynx down into the laryngopharynx. Now, it doesn't just drop due to gravity. There are muscles within the pharynx that contract and through peristalsis move that bolus of food down into the laryngopharynx. And this is a very rapid movement of the bolus of food, and it's facilitated by certain muscles called the pharyngeal constrictor muscles. There are three of these pharyngeal constrictors, the superior, middle, and inferior pharyngeal constrictors, that facilitate this peristalsis and essentially move that bolus of food from the oropharynx down into the laryngopharynx. And we'll be covering these pharyngeal constrictors next after this introduction in this video. In addition to the peristalsis that moves the bolus from the oropharynx to the laryngopharynx, there's a couple other things that also happen during swallowing. One is actually opening of the pharynx, and this actually occurs before the peristalsis, and it allows the oropharynx to really accept the bolus of food from the oral cavity. And so that pharyngeal opening is facilitated mainly by this muscle, tensor veli palatini. Helps open up the pharynx to accept that initial bolus of food. Also, the pharynx and the larynx are going to elevate, meaning the entire pharynx is going to move up closer to the oral cavity. If you put your fingers on your thyroid cartilage on the front of your neck, basically your Adam's apple, apply a little bit of pressure and swallow, you'll actually feel the contents actually move up. Now, because you're palpating there the thyroid cartilage, technically you're palpating the larynx, but the pharynx is right behind it and it does the same thing. So pharyngeal elevation, in addition to laryngeal elevation, is facilitated by these muscles of the soft palate. Those would be the palatopharyngeus, salpingopharyngeus, and stylopharyngeus muscles. And with the pharyngeal opening, the pharyngeal elevation and peristalsis, the bolus of food moves from the oropharynx to the laryngopharynx, and then ultimately it's going to have to move into the esophagus. This structure, the UES, is the upper esophageal sphincter, and it basically serves as a gatekeeper that controls whether or not a substance, like a bolus of food, is able to move from the bottom of the laryngopharynx into the esophagus. And so this structure has to relax before any bolus of food can be accepted by the esophagus. We'll be covering that and the esophagus in a few videos from now. The last thing that has to happen here is closure of the epiglottis. Let's zoom in down here at the bottom. If we look at picture B, this bolus of food is partly in the oropharynx, but a little bit of it has reached the laryngopharynx. And if you look right here where my mouse is, this structure that the bolus of food is basically sitting on top of, it's not labeled yet, but that is the epiglottis. Now, inferior to that, we have two structures. We have the trachea, which sits anteriorly, and the esophagus, which lies directly behind that. Now, obviously, the bolus of food should go into the esophagus, but it should not enter the trachea, because if it enters the larynx and then therefore the trachea, we aspirate on the food, and that's basically choking. And the trachea doesn't have any considerable constriction. It can't just close off to prevent boluses of food from entering it. And so the way that you prevent a bolus of food from entering the larynx and therefore the trachea is by putting a cap over it. And the epiglottis right here is essentially that cap. So as the bolus of food right here is moving down into the laryngopharynx, it's going to sit on top of the epiglottis and basically push the epiglottis down over the entrance of the larynx. You can see it actually pushed down over here. And so by covering up the larynx, you prevent it from entering the larynx and the trachea. And so now that bolus of food only has one choice, and through relaxation of that upper esophageal sphincter up here, the bolus can enter the esophagus. And as I mentioned in a few videos, we'll be covering the details of the upper esophageal sphincter and the esophagus. For now, let's finish this video by looking at the pharyngeal constrictor muscles, and in the next video, we'll look at the palate muscles. Before we go into the individual muscles, let's review some relevant anatomy. So at the top here, we actually have the skull, and we're actually looking at a coronal section of it so we can see inside and look at this trabecular bone. These downgrowths right here on either side, like this one, these are the mastoid processes. Now the mastoid processes aren't really relevant here for the muscles of the pharynx, but it just provides a landmark so you kind of know roughly where we are. If we go to the bottom of this picture, this is the esophagus. Now keep in mind that the way we're viewing this, the esophagus is actually closest to the viewer. Okay? If we go up here, this entire region, okay, up here, this is the larynx. The way we can tell that is this structure right here is actually meant to be the epiglottis. The epiglottis kind of marks the boundary between the laryngopharynx and the larynx. Right here you can see the thyroid cartilage. This is actually more or less the top of the thyroid cartilage. We can follow its lateral boundary, and then this is probably the inferior boundary, roughly, of the thyroid cartilage. Below the thyroid cartilage, this is the cricoid cartilage. And so this region up here is going to be the larynx. Okay? Below the larynx, and in the picture behind the esophagus, would be the trachea, which we obviously can't see, but we can see the thyroid gland, and the thyroid gland would actually sit anterior to the trachea. Okay? So we know we're looking at a posterior view. We know we're looking at a posterior view because we can see the thyroid in the back, but the esophagus is actually closest to us. So this whole thing is a posterior view. Okay? Now over here we can see a little bit of the hyoid bone, only a small piece. This is actually going to be the greater horn or greater cornu of the hyoid bone. At the top here, actually part of the occipital bone, there's actually a little bump here called the pharyngeal tubercle. And some of the muscles, in particular this one, which we'll see as the superior constrictor, actually have an attachment on this. Also right here we actually see part of the eustachian tube, also called the pharyngotympanic tube. This right here is specifically the cartilaginous part of the eustachian tube. And again, we're going to see later on in the next video a deeper muscle, this one that actually has an attachment there. Also, this right here, this white tissue is fascia. This is the pharyngobasilar fascia. And again, you can see here this muscle, the superior constrictor, actually sort of blends with that fascia. And then in the middle right here, going down, we actually have the median pharyngeal raphe. Sometimes it's called the pharyngeal raphe. Now these muscles occur in layers. I'm getting a little bit ahead of myself, but if we look here, we had a superior constrictor, middle constrictor, and the larger inferior constrictor. And we had these on both the right side, which we still do, but they were also on the left side. Now on the left side, they've been peeled away. So you have to imagine what we had on the right, we also had on the left side, but these muscles were sort of peeled away, like we turned the page of a book. And so right here, this would actually be the superior constrictor. Middle one's right here, and then this is the inferior constrictor. We just basically took them, detached them from the pharyngeal raphe, and peeled them away. And you can see inside, there's a bunch of other muscles here, mostly muscles associated with the soft palate. Those are going to be the ones that we actually cover in the next video. Here, we're really just going to talk about the pharyngeal constrictors, so let's actually get to that. The first one we're going to look at is the superior pharyngeal constrictor. Now, this muscle's origins, you really can't see here. Okay, we're looking at a posterior view, remember, so all the origins are really going to be anterior. But I'll go ahead and list them. The superior constrictor originates on the pterygoid hamulus, which is really just a projection of the medial pterygoid plate. We also have the pteromandibular plate, the mylohyoid line, or at least its posterior aspect, and also the tongue. Obviously, those structures are all anterior. We can't actually see them. But we can see the insertions of the superior pharyngeal constrictor. One is on the occipital bone, and specifically it's this downward projection, which is that pharyngeal tubercle. Okay? We can also see that this superior constrictor blends not only with this pharyngobasilar fascia right here, but also with this muscle below, which we'll see in a minute, is the middle pharyngeal constrictor. Now, all three of these constrictor muscles are going to be involved in constriction of the pharynx. And when I say the pharynx here in this context, we're of course not talking about the nasopharynx, which is way up by the nasal cavity. Of course, you don't have any swallowing there. We're really talking about the oropharynx all the way down through the bottom of the nasopharynx. So here when I say constriction of the upper pharynx, I'm referring to the portion of the pharynx closest to the oropharynx, not the nasopharynx, all right? And when we talk about the contraction of these three muscles, they occur in a coordinated manner. So when you swallow, it goes from top to bottom. So you obviously have to have the superior constrictor contract first, followed by the middle constrictor, and then the inferior constrictor helps move that bolus of food down into the esophagus. And this occurs in a very rapid, coordinated manner. If you put two fingers right on your thyroid cartilage on your neck, apply a little bit of pressure and swallow, you'll feel how quick that movement is. So the contraction of these from superior to inferior is very fast. Now, the innervation of the superior pharyngeal constrictor is through the pharyngeal plexus. We talked about the pharyngeal plexus in a past video when we discussed the vagus nerve. This picture represents the basic course of the vagus nerve, cranial nerve 10. And right here is the inferior ganglion of the vagus nerve. So if we look at this downward projection of that, this is the pharyngeal branch. Now, a little bit of anatomy here. Here's your thyroid cartilage. Then this is your trachea down here. This is the esophagus. So that makes this the inferior constrictor, and then this one is actually the middle constrictor. The superior one is not shown here. If you notice, the pharyngeal branch actually targets the middle constrictor, so it has to innervate all three of these. So it chooses basically right in the middle, so it's kind of in a prime position to get all three of these. And the pharyngeal branch is also going to combine with other branches of cranial nerve 9, which is the glossopharyngeal nerve, and a small branch of the spinal accessory nerve, cranial nerve 11. And so all three of those nerves run together from cranial nerves 10, 9, and 11, and they reach the middle constrictor, and they form a plexus. And this plexus is going to serve basically the inferior, middle, and superior constrictor, not shown, but it's also going to get some of those soft palate muscles that we'll see in the next video. And the main exception to that is the tensor veli palatini muscle, which is actually innervated by a branch of the trigeminal nerve. We'll get to that later on. Okay? So that is the innervation of the superior pharyngeal constrictor. Notice that it has more of a contribution from cranial nerve 10 than it does 9 and 11. Okay, so mostly vagus. And the blood supply is through two main arteries. One is the facial artery through a tonsillar branch, and then also the ascending pharyngeal artery through a pharyngeal branch. Now let's move on to the middle pharyngeal constrictor, shown here in green. Again, this lies right beneath the superior constrictor and actually blends with it posteriorly. The origins of the middle pharyngeal constrictor we can't really see. One is going to be the stylohyoid ligament. This would of course be a ligament that connects the styloid processes to the hyoid bone. Again, we can't see those. And then also the hyoid bone itself via the greater and lesser horns. Remember, these right here are the greater horns. We can't see the lesser ones. They're more medially placed and they're more anterior, so we can't see those. But these would be the origins of the middle constrictor. The insertions we can see, and the first is this one that occurs right down the midline. This is the median pharyngeal raphe, which actually continues all the way down through the inferior constrictor. And this part actually serves to connect the left and right middle constrictors. We can also see the middle constrictor blends with the superior constrictor above it and the inferior constrictor below it. And so when we talk about this pharyngeal constrictor network of muscles, it's not so much three separate muscles, it's really just one continuous muscle with three arbitrarily defined regions. Okay? Now obviously it's going to function to constrict the pharynx, but it's going to be the middle of the part that we're talking about. So more or less the bottom of the oropharynx and kind of where that becomes continuous with the laryngopharynx. All right? Again, its innervation is the pharyngeal plexus, and its blood supply is the same as that of the superior constrictor, the facial artery through the tonsillar branch, and the ascending pharyngeal artery through the pharyngeal branch. That leads us to talking about the inferior pharyngeal constrictor. You'll notice this one is a lot larger than the other two. This is the biggest one, and so it actually has two parts. It has a thyropharyngeal part, which is the upper part, and then it has a cricopharyngeal part, which is the lower part. We'll talk about the upper part first, the thyropharyngeal. This one is going to have its origin on the thyroid cartilage, specifically at the oblique line. If we go back to this anatomy video, you'll see the thyroid cartilage right here. From about this point right there, all the way down to the bottom, this is all the inferior constrictor. See, if you follow these muscle fibers, you'll actually see some of these actually going to the thyroid cartilage. The ones that go to the thyroid cartilage, those are going to be the upper part of the inferior constrictor. But down here is the cricoid cartilage, and you'll see some of those fibers actually go more to the cricoid cartilage. So when we look at this, the thyropharyngeal part originates on the thyroid cartilage. The cricopharyngeal, or lower part, originates on the cricoid cartilage. All right? Now in terms of the insertions, we can see those. The thyropharyngeal part is going to insert on the medial pharyngeal raphe, and it's also going to blend superiorly with the middle constrictor. Okay, remember these are all continuous. And if we follow that median pharyngeal raphe down, it pretty much terminates right here. You can see its termination. That's the limit of the upper part. So basically, if we trace this region right here, above that is the thyropharyngeal part. Below that is the cricopharyngeal, which is lower and much smaller. And so that means this right here is the cricopharyngeal part. You can see here that this is actually going to blend with the esophagus inferiorly, and it's actually going to blend specifically with the circular fibers of the esophagus. Again, the action of this is to constrict the pharynx. It's going to constrict pretty much the laryngopharynx component and help squeeze that bolus of food down ultimately into the esophagus. Now, if we look at the innervation of the inferior constrictor, both of these are actually innervated by the pharyngeal plexus, both thyropharyngeal and cricopharyngeal. However, the cricopharyngeal, being closer to the esophagus, actually has an additional piece of innervation, and that's actually the recurrent laryngeal nerve. This should actually say laryngeal, not pharyngeal. So it's recurrent laryngeal nerve, which, if you remember, actually comes from the vagus nerve. You can actually see as the vagus nerve goes further and further down, a piece of it actually loops off and actually moves back into this area. This would actually be the recurrent laryngeal nerve, specifically on the right side. Okay? There's also one on the left that also helps innervate the left cricopharyngeal part of the inferior constrictor. All right? Now the blood supply is consistent throughout the muscle. It's going to be the ascending pharyngeal artery through the pharyngeal branch, but also through the inferior thyroid artery through its muscular branches. So those are the 3 pharyngeal constrictors. Going back to this anatomy piece right here, remember, once we peel off those constrictors and kind of peel them away like the pages of a book, as we have here on the left side, we'll be able to see the deeper muscles, and these are generally going to be soft palate muscles, and we will cover these in the next video, so make sure to join us there. Thanks for tuning in. Please like, subscribe, and check out my Instagram for cool science and not science stuff.